At its very core, drug science must remain independent. This means we don't accept sponsorships. It's with the support of the drug science community we're able to do this and make the podcast in the first place. If you're able to become a drug science community member and support the show, you too will be supporting the dissemination of evidence-based drug policies. Without you, none of this would be possible. For anybody interested, there's a link in the show notes. Thank you. Hello and welcome to the Drug Science Podcast with me, David Nutt. Here we're bringing together experts and activists for a rational, honest and informed conversation about drugs.
Welcome to the Drug Science Podcast with me, Jo Neal, and Dr. Hannah Thurger. Now today's guest, very special for me and Hannah for many reasons. She's from the University of Manchester, and of course Hannah did her PhD postdoc at the University of Manchester, and I'm still there. So Sara has taken part in many events that I've organised explaining the psychotherapeutic component of psychedelic therapy and how important this is. So I have learned a lot over the years. So when I was starting to work on psychedelic medicine, about 6 years ago, I took a sabbatical to learn as much as I could about the topic. And Sara, who has been working in this field for many years, helped me a great deal from her own expertise. So I have learned a lot from her. And by introducing me to other experts in the field. And I particularly remember meeting Peter Gasser, thanks to Sara. So that was very special. Sara's a professor of clinical psychology at the University of Manchester, and she's also a practicing NHS consultant clinical psychologist. Her research focuses on developing interventions for complex problems that affect mental health, including trauma, mood swings, and psychosis. Now, she's done a great deal in this field, but particularly training the therapists in some of our major psychedelic trials. And she's currently training people at the moment. She might mention that. So what we really want to do today is to have a deep dive into the psychotherapeutic component of psychedelic healing that is so integral to the process of healing. So very warm welcome, Sara.
Oh, thank you, Jo. And Hannah, what a lovely welcome. That's really lovely. Thank you. And I love a deep dive into the psychotherapy because it's, of course, something that we don't hear so much about and doesn't get spoken about as often.
Yeah, which I think could be a little bit problematic. So would you want to start by telling us a little bit about your role at Manchester, how your career started maybe in this field?
Yes, of course. So, I've been at Manchester now for, about 30 years. Just a bit of a shock saying that. And of course, my background it's always been in academia and in applied psychology, so working within the NHS. And I've had a number of substantive clinical posts over the years. But I suppose my research background and the area that I was really quite focused in was actually psychosis. So a lot of my research has been in that area. And in some ways, it's an interesting segue into psychedelics because helping people understand what has been quite an unusual experience and often one that doesn't make so much sense to other people. Helping them to use that narrative to really gain insights into where in their life maybe changes do need to be made. I mean, that's what we're doing in psychosis. And of course, that's exactly what I'm doing when working with people who've had a psychedelic as well. So lots of parallels for me. And I suppose the work that I focused on is, providing non-medical or psychological treatments for those sort of problems, so some of the most severe problems that affect mental health. And I'm choosing my wording quite carefully there as well. I've moved away from talking about mental health problems, which of course locate the issue within the individual, and talk about problems that affect mental health in recognition of all of the things that go on in people's lives and within the world that we live in that can be quite disturbing for people and cause mental health problems. So, my work's really been about developing non-medical treatments in those areas. And from that, seeing then how we can use that alongside some drugs that may help facilitate that process. And my work's been largely looking at what are some of the most, effective parts of different psychotherapies. Now, I've trained in psychodynamic therapies. Cognitive behaviour therapy is such a massive thing in Manchester. I've been privileged to work with some of the best in CBT, and of course had the honour of working quite closely with Erin T. Beck as well. So using all of that work, and then over the years moved away from just CBT to saying, why don't we focus on the bit about psychotherapy that we think might be most important and effective for people? And so that's what I've been doing in psychedelics as well, is trying to channel that alongside using drugs.
I think it's really interesting with psychosis, having worked in that field a little bit in drug discovery. The focus always, to me, seemed to be on the medicine rather than the therapy. So it's been really interesting meeting you.
Not dissimilar then to psychedelics, where we're getting quite a lot of focus on the drug itself and less on what happens therapeutically. And of course, my understanding of psychosis is that, and just for listeners who might not be clear on what psychosis is, these are experiences which are considered unusual because people may hear things that other people don't hear, or see things that other people don't see, and of course develop unusual beliefs such as, that person's going to harm me, and getting quite distressed and anxious about that with no real evidence for that happening, and that person might say, no, I have no intentions of hurting that person, and yet they believe that they are, and beliefs can feel quite unusual. But to me, psychosis is all about a very functional response to a very difficult situation in life. And people regard it as being very biological, and therefore drugs are the way forward, much the same as what we get when people come into psychedelics with a whole host of different issues that may be fueling their distress. And drugs can be very helpful in helping them gain some insight to that. But really, for me, the therapy is about providing the dialogue and the narrative by which they develop awareness of the issues that have brought them to that place and brought them to that distress.
So in terms of psychedelic therapy, how has the therapy research evolved as this sort of the field has evolved? And how does it sort of stand in relation to evidence-based psychotherapy? Is it kind of the same as lots of standard psychotherapy?
I suppose in a nutshell, it's actually quite hard to answer that, because when you read a lot of the trials and you hear about the studies, they don't say an awful lot about what the therapy involves. It really is quite scant within the literature. We know, particularly when you listen to people like Bill Richards at Johns Hopkins, where they talked about the therapy that was provided in the original studies, many years ago, back in the 1950s and 60s, before the prohibition. And that was largely a non-directive form of therapy. And of course, now people are talking about much more structured and manualised therapies and how those could be used alongside psychedelics. But the degree to which they have in the literature, I'm not sure is very clear at all. I think it's been, therapies either been very non-directive, where it hasn't sort of been in accordance with a particular therapeutic model, or studies are now saying, right, we're going to do quite a focused course of CBT alongside psychedelics, or acceptance and commitment therapy, for example. What we've tended to find in the therapy, in the field of psychotherapy generally, is something that's come to be known as the having a real word-finding difficulty there. It's from the dodo bird effect. That's the word I'm looking for. And it's called that from Alice in Wonderland, this idea that all therapies are actually quite equal, all of them yield results. And I must admit, we do tend to, when we've had therapies compared, quite often everybody gets some form of effect. And of course, the therapy where there's the most evidence is, of course, CBT, cognitive behaviour therapy. But that's because perhaps there's been most research in that area. And when you start to get research on other approaches as well, like acceptance and commitment therapy, even metacognitive therapy is becoming quite known, we see fairly similar results. And so it's brought us to thinking that perhaps there is something that is common to all of those therapies that may be delivering the key effect. And then, of course, there's also the novel bits that each therapeutic approach has. I'm a strong believer in that probably those novel bits, so the bit that makes it CBT or the bit that makes it ACT, might actually be less important than the bit that's common to all of those. And there's something about attentional mobility and what's been known to be called psychological flexibility, which seems quite important across all of those different therapies. And so what I've been trying to do, certainly in the psychedelics field, is say, well, if we have a therapy that focuses on that bit and that's really developed at helping people step back and gain awareness of the things that might not be so good in their life and awareness of some of the patterns or the attempts at trying to control things that they implement, and helping them get some perspective on this or what we might call introspection, that could end up being the thing to do, rather than us getting into a situation where we end up having to test hundreds of different types of therapies alongside psychedelics, which I'm a little bit concerned could end up being a problematic place to be.
We haven't really got time, and then, people get confused, I suppose. So do you think a different type of therapy for different treatments?
Well, that's the situation we're in at the moment. We have, literally, we have hundreds and hundreds, up to about 1,000 different therapies. And they're all quite disorder specific. So in the field, we always talk about, different disorders. I personally don't believe that somebody has a disorder. I am certainly not denying the distress and the difficulties that they have with functioning and that they absolutely need support and help. But whether there is some kind of disorder, I really don't adhere to that approach. So I think our therapies are about helping people firstly identify what it is in their life that doesn't feel the way they want it to be, and then helps them focus on that long enough to be able to start to come up with solutions that may be new ways of dealing with those problems. And that
seems quite revolutionary. Is that how therapy kind of normally works?
Well, for me it does, but I know there's a lot of people out there who might disagree with that. I believe that pretty much any form of mental distress comes about because somebody has something in their life that just isn't the way they want it to be. So as human beings, we're constantly trying to maintain biological, psychological, and social variables within pre-specified parameters. We need to keep them, just right, so to speak. And when we don't feel able to control things in a way that we want, we of course become very distressed. And the most common reason why we become distressed and can't control them is we've got more than one thing that we're trying to keep within a pre-specified parameter, and controlling one of those things isn't compatible with something else. So, for example, I'm sure we can all relate to wanting to be quite successful in the workspace and wanting to do well at work, and at the same time wanting to have friends, family, a personal life. And when the two aren't compatible, we feel distress. And of course, for most of us, we're dealing with these kind of incompatibilities on a daily basis, and they're not necessarily difficult to find resolutions to. But if you've got something that's a little bit more long-term and your attempts to find a resolution or a solution to balancing it doesn't go right, and that incompatibility is chronic, well, that distress can become quite disturbing. And then you're into a situation where you're trying, often quite randomly, to keep things under control, and it may get worse, and that distress can turn into quite significant symptoms, a variety of mental health issues.
I can imagine, Sarah, there are people listening to this who are thinking, oh, yes, yeah, I can really relate to that. The stresses of modern life and the kind of conflicts that we're in a lot of the time.
Absolutely. And earlier you were talking about, gambling, because we mentioned that I'd just been down to London working with the team who are going to be running a study on psilocybin for gambling issues. that's a common problem that we're hearing about more and more. And, a typical example of that might be someone who, their overall sort of just right state might be to live a really good and meaningful life. And yet the way in which they go about living that good and meaningful life might be, on the one hand, to feel very in control of their finances, to feel as though they're very respected by others. They're an autonomous being who provides stability to their families. All of those things that we would commonly describe as being very functional. And yet, on the other side, they may also have a need to feel like they've got a bit of excitement and possibility in their life. Be able to be spontaneous and lucky and feel quite special, not to have monotony all the time. And again, nothing wrong with that. But if the ways in which you then operationalize those just right states mean that on the one hand, you're taking risks and perhaps gambling to have that excitement, and then on the other hand, trying to avoid temptation and budget, the two don't always go together, do they? And you'll find that people can get into a real pickle, and then they're bouncing between the two, but never really achieving either to their full aim. There, you've got the potential for chronic incompatibility and conflict, and then you'll get shifts in how people behave, and it looks very odd to the outside world. And the more the longer that goes on for, people can get very distressed and things get really difficult, and they lose sight of their behaviour. They're so focused on their experience, they lose sight of what they're even doing to try and maintain that. And then you have prolonged issues with things like gambling. So, of course, in therapy, what we're trying to do is get them to become very much more aware of both sides of the incompatibility. People come to therapy and they're very sure that they want to give up gambling, and they know they don't want to be doing that, but they're far less aware of all the reasons for why they are doing it and all of the other things. So therapy is about helping them take that step back and get some introspection and find some ways of balancing both of those needs rather than picking one over the other.
And so is that a core similarity with the different psychotherapeutic approaches that you've tried to incorporate into the psychedelic training programs you've helped with?
Well, I think, for example, for CBT, so cognitive behaviour therapy, they may be doing quite a lot of that, helping people to gain some perspective and awareness. But often there's a bit of a push for people to identify behaviours that they do want to be doing, so the giving up gambling, and really supporting people to being able to do that. The difficulty there is there's far less awareness on all of those reasons for why maybe they do want to gamble. How does that relate to their values? And of course, some people out there might say, well, ACT does that, acceptance and commitment therapy. Again, it can. And there are lots of different therapies that might help people get to that point where they have that awareness. But often, I'm of the opinion that there's a lot that takes place in therapy which is not always necessary and so helpful. So I suppose I'm trying to streamline it a bit and say, if we spend less time doing the novel bits in therapy and more time doing the bit that we think that works, and that's helping with that awareness and really helping people think about why it's specific in their life. Because every conundrum, every situation is extremely idiosyncratic and individual.
Sarah, is this the kind of therapy that would start before a person takes a psychedelic?
Not necessarily. What is possible is that people can come through into a study and do psychedelic-assisted therapy. They may not have had any therapy before. They would spend psychedelic-assisted therapy usually comes in three main phases. The first phase is about preparation. Some of that might be orienting people to a particular therapeutic model, but it's also about helping them be prepared for what might come ahead. So there's no surprises. Preparation is all about getting somebody ready to go to the unknown. We don't want people to be so anxious and out of their comfort zone that they can't engage with the process. But similarly, we don't want them so relaxed and, this is nothing to worry about, that they're not challenged a bit. So preparation's also all about getting them ready for that bit. Then they have the dosing. and the dosing's about the full-on trip, I suppose, or experience, where they're going through all sorts of material memories, sort of new experiences that are related to whatever the problem at hand is. They're collecting all sorts of experiences in dosing. And then integration, which is more of the psychotherapy element, which comes afterwards, that's about unpicking those experiences and making meaning from it. I compared it to working with people with psychosis earlier. In many ways, the psychosis could be the experiential, the dosing bit, where we're unpicking all of those experiences because we know that there'll be lots of symbolism and events that relate to people's lives and the problems they're experiencing in their lives. That's where they start to use it more symbolically and unpick it in integration to make meaning from it and to help them make sense and find new perspectives and solutions. So they could come to psychedelic therapy without having had any before.
Sarah, it's essential to have the right therapy to make sense of this experience, I would say.
I believe it is, because therapy is more likely to make the experience feel supportive. It's more likely to help people stay in that sweet spot where they're not so underwhelmed, like I said, that they're not really making any new discoveries, but they're not feeling so overwhelmed emotionally that feels too much and they're unable to gain more from it. But of course, we see this in everyday NHS, where people are on waiting lists waiting for therapy, and quite a few people are known to spontaneously recover. It's not impossible. So I guess you could take a psychedelic and you may get some insights, you may get some benefits, but it's unlikely, especially if you do that in a recreational setting where it's poorly controlled. There's a high chance that that's just going to be overwhelming and anxiety provoking. So I wouldn't really recommend that. I'm not saying it's impossible without therapy, but I think it's just far less.
So, Sarah, we should be a little bit worried then about the pharma narrative that the drug alone is enough. And as long as you have a sort of a therapeutic support, that's kind of enough.
It does worry me, yes. Especially because, so far in trials, let's face it, we've been working with people with very specific problems that affect their mental health. There's lots of work with healthy controls. I'm concerned that they may not completely represent the people who are going to come through our doors, certainly on the NHS, where people often meet criteria for multiple diagnoses. They've had difficulties for a long time and they're quite anxious. They're easily overwhelmed. It worries me that we would put those people in a position where they take a drug that they may never have had before and we expect them just to do all of the work for themselves. Well, why would we? I'm not saying it's impossible, but the chances of them being able to go through that and figure out where the issues are and make the connections and develop awareness and come up with solutions and be able to put those solutions into practice and it all go well. You're just putting a little bit too much to
What
chance.
do you think are the potential consequences of that?
Well, I don't want to sound as though I'm being a little bit catastrophic and saying, oh gosh, this is really all going to end up in disaster. But, some people who are anxious and maybe don't know what they really need from therapy. There's lots of people come seeking help and they're not quite sure what the issues in their lives are. They've had a lot of trauma. They've had a lot of relationships where trust has been broken. To then come into a space where they have one of the most unusual experiences they've ever had in their life, there's always going to be bits to that could be quite challenging. There's a real danger that may be so overwhelming that the person even experiences things that are quite similar to psychosis, or they feel as though they've been a bit let down by the people who gave them the drug because they weren't there supporting them when they needed it. People can end up having much more long-term issues, or they come to some awareness and they come up with a solution or a realization of what they think is going to be good for their life, and it ends up being the worst mistake they ever made because they didn't have someone there to just help them think it through from different perspectives before they went away and actually made that change. I have heard stories like that, and it does sadden me that that people weren't given the opportunity to get help in the right way.
No, absolutely. So what do you think the psychological skill set that's really required from a therapist?
First of all, a therapist needs to be quite open and also very attentive. I think that's what we often call being present. But really, for me, that's having your awareness completely on the person you're working with and being very attentive, both to not only what their needs might be, but some of the things that may well come up for them in a psychedelic session. Knowing a lot about that person's past and some of the experiences they've been through would help me be able to predict what could well come up. And for some reason, when people take psychedelics, we know that their minds tend to go to where the problems are. It's just something that happens. So, if you're there and nobody's supporting you and you don't know what to do in that situation, that's going to be pretty awful. Whereas a therapist who's trained and has an idea of what might happen for that person, they're going to be able to be there in a way that's right for that individual. That's giving them enough space to be able to process things for themselves, so knowing when not to intervene, but also not leaving the person alone and sort of going through it when they may end up having an experience which takes them out of that ability to have that introspection and be able to think things through. I mean, some of the work that I've done over the years, not just in psychedelics, but thinking about what is most helpful for therapy, we came up with 4 key things that we thought was really essential. And that was being able to hold your attention on a problem long enough to be able to experience the emotions associated with that problem at hand. And of course, what we know is that when people are very anxious or not managing emotionally, actually holding your attention on something that's challenging is enormously difficult. So they may not be able to just do that bit for themselves. And they certainly, when the difficult emotions come up, they may well start to do things to try and move away from that emotion, avoidance, or they may get into a lot of ruminating. And when we take psychedelics, the impact on emotions is that they can become incredibly intense. So, of course, for some people, the desire to implement a strategy to try and keep that under control, like ruminating or like becoming very anxious, could actually become much more intense rather than less. So that wouldn't be good. The other 2 things that I said the work that I've done over the years has identified as being really important is being able to externally express how you're feeling and things. Now, in psychedelics, that tends to happen in the integration, not obviously in the dosing session, but the opportunity to be able to talk externally about those experiences is key to the 4th element, and that's actually getting evaluative perspectives, sort of going up levels in your awareness and being able to think about it from a number of different viewpoints. If you can't externally express it and you're just stuck inside your own head, that's not a good place to be. And anyone who's spent any time ruminating will know that far from being a multi-perspective approach, it tends to rabbit hole you right down in there with your problems, so you can't do anything about it. Those are some of the things I feel will happen if you don't have good support when you're taking a psychedelic.
Psych Symposium returns to London this winter on Thursday, 4th of December. It is Europe's most focused event for psychedelic medicine, drug development, and mental health innovation. Hosted in partnership with Prohibition Partners, this one-day summit at Conway Hall brings together the leaders shaping this field. Investors, regulators, biotech founders, researchers, and clinicians will all be in the room. We will explore clinical trial design, neuropsychiatric innovation, formulation strategies, and access frameworks for psychedelic therapies. With over 400 senior stakeholders attending, this is the best place in Europe to build the partnerships that will matter most in 2026. Tickets are now available at psychsymposium.com. You can register for the event and find out more in the show notes. Speaker submissions are also open for those with fresh data, policy insights, or clinical experience to share. If you are looking to build visibility with decision makers, tailored sponsored opportunities are also available. Visit psychsymposium.com and join us this December in London.
So how can we make sure that the therapy remains evidence-based?
I mean, my big thing is let's not go down a route where we are testing every single therapy available for every disorder-specific approach. I would much prefer to see us working more transdiagnostically, so that's in a way that may work for a whole broad range of problems, regardless of the diagnosis somebody may be given. And I think there are therapies out there. Obviously I have my own therapeutic orientations, and how I work therapeutically is about trying to focus on the thing that I think is common across a whole range of different therapies. That's the direction that I believe we should go in. But if we're going to remain evidence-based, we really do need to make sure that we have clear manuals, clear directions for psychedelic therapists, and we're testing those against whatever it is the application of that psychedelics being used for. But it would be great if, rather than just saying, oh, let's look at it for anxiety or for depression or PTSD, let's go back to that transdiagnostic element I was talking about and say, what's the common thing across all of those diagnoses? And I really think that is about attentional mobility and awareness. I personally think that would be a good way to remain evidence-based, but I'm not sure we're heading in that direction, unfortunately.
Have you designed any approaches specifically focusing on that attention and flexible mobility? Like, how would you design the kind of package for the preparation and integration to really focus on just those common themes?
Yeah, I have. And some of the work that I have done previously on trials has used that approach. So I'm quite informed by a framework of understanding for mental health called perceptual control theory. And there is a therapy that that is based specifically on that framework. And I mean, I won't talk about it in too much detail just because of time, but the way in which mental health issues are understood from that framework are a little bit similar to what I explained earlier, that we have multiple. Life's about spinning plates, isn't it? We're all spinning loads of plates. And, when those plates kind of aren't compatible, so one or two plates we're spinning then cause another plate to spiral off and smash on the floor, it's a bit of a disaster. And we need to find a way of understanding and knowing what are the different plates we're spinning. So whatever solution we apply to that, it isn't going to cause some of those plates to fall down in favour of others. We need a solution that allows all those plates to spin simultaneously. So my approach to understanding mental health issues are that, people develop issues and distress because they're doing things that may be great for some plates, but not so great for another. And they just need to come up with other solutions. And the therapy that I've been working on that's based on that understanding, it's actually called the method of levels, uses solely questions, which I know a lot of people find a bit of a challenge. But those questions are always done in a very sensitive way. And the reason we use questions is it's designed to hold people's attention on a problem at hand long enough for them to be able to start thinking about or developing awareness of all the different plates that they're spinning, and then start to talk about how are they currently spinning those plates. And as they're talking and we're asking questions that help them develop that awareness, they realise where actually one approach that they might use, so for example, a person might say they sweep things under the carpet, and the questions I might ask would really be quite concrete. How far under the carpet do you end up having to sweep that? How's that working for you? They start to gain some insight into, well, actually, that's not working very well at all. Well, is there something that you could do that you think might work better, given all of the things you've just been telling me about that you're trying to manage? So my questions are designed to help them think of solutions from their frame of reference. It's not me giving advice or telling them what to do. They're thinking about it for the first time from a perspective that they haven't done before. And that's worked really well in integration sessions.
I was about to ask you, with the new perspectives from psychedelics, is that why you feel like it's lended itself well to psychedelic therapy? You've already got that potential new perspectives, I guess, more flexibility already, maybe even different worldviews. So already when you're asking these questions, have you really felt like it's been a different approach to not having the psychedelic dosing experience beforehand?
Yeah, absolutely. And when people are talking about the experience that they had during the dosing, in my questions, I'm always bringing it to the here and now as well. And the framework that I was talking about, it's very much a biopsychosocial framework. So it's this idea that biological processes are inherently part of a system of control that we have. And they are based at the sort of lower levels of that hierarchy where it interacts with the environment. So when I'm talking to people in integration, I'm focusing their attention very much on some of the more physiological sensations and things that they're having. So they develop awareness of not only why something's a problem, but how they're experiencing it as a problem. And their awareness goes to all different parts of the way in which they're managing their problems, so that they can be thinking, well, if I don't do this, what would work for me? So it gets really idiosyncratic and very relevant to that individual. So the conversation you might hear me having with one person isn't going to look the same as the conversation I have with somebody else. But the principles, what I'm doing in the therapy, always remain the same. And that's helping them to articulate their problem, get in touch with the emotions about that, and start to think about potential solutions in a way where they're not just taking into account one of the plates that they're spinning, but a whole range of them.
Okay, and so the principles stay the same. Can you put that into manual? Like, can you manualise that for clinical trial?
I have manualised it.
Okay, great.
Yeah, so I've manualised that for a previous trial. This approach has been manualised anyway because it's an approach I use in general psychotherapy. And the method of levels, if you wanted to go and read up on that, is an existing approach. But of course, when using this within psychedelic-assisted therapy, there have been some adaptations because rather than the person just speaking about anything they want, of course, the focus of the conversation is very much on what they've experienced when they were under the influence of the psychedelic. So I don't call it the method of levels because obviously it's different to that therapy, but nonetheless it's very much informed by the theoretical framework, and there's lots of overlap in what you'd see me doing.
Okay. And how do you think that psychedelics really helped people to kind of lock in and change those control systems that they might have had before? What ways do you think they help people with their own psychological flexibility?
So when I talk about things being organised hierarchically, I'm really talking about we're all as human beings control systems. And at the lower levels of those hierarchies, we're controlling quite basic processes and mechanisms. That's where all of the biological processes are going on. And, they're interacting directly with the environment. And of course, when we take a psychedelic, it down-regulates a lot of those control systems at the lower end of the hierarchy. So it's much more difficult for someone, I'm not saying impossible, but much more difficult for someone to apply all of their usual control systems when they've taken a psychedelic. If you're someone who tends to ruminate a lot, or you do a lot of thought suppression, for example, with your anxious thoughts, it can be quite difficult to actually do that because they've all been switched right down due to the psychedelic. Now, as we move up the hierarchy, we're moving much more to more abstract thinking and principles and values for an individual. How you want to live your life, the way you want to relate to other people, the kind of person you want to be. Those are all very abstract frames of reference that we have. Now, they're not different systems. They're connected to biological systems. They all operate and they interact. So they're part of the same hierarchy, in other words. When we turn down what's going on at the lower end of the hierarchy, it's much more easy for those connections to start to mobilize and what I call reorganize. So when we've had a psychedelic, at that abstract level, there's a lot more mobility and things going on. And then when you are back out of that, some of those new ideas, some of those new perspectives very often filter down and change people's behaviour and help them do that. Now, of course, all of that can happen outside of psychedelics, but for a lot of people, it's very difficult to stop applying those control strategies.
Yeah, and if you've been stuck in it for years and you've had those ruminating thoughts for years, a tool that might just help you get to those other ways of thinking.
Absolutely.
You often psychedelics are referred to as a tool. I don't know if you like that analogy or what analogy you apply for it.
I met somebody the other day who'd had a psychedelic healing experience 7 years ago, and they said they were still processing it.
I hear that a lot, especially when I'm training clinicians who may actually have had, been involved in a trial or had a psychedelic experience themselves. Quite often when we're doing role plays and demonstrations of how to actually do the integration, some clinicians have said, well, I'm willing to talk about an experience I had years ago that I haven't really integrated very well. I've had some amazing experiences with those people and the things that have come up for them several years later. I suppose in some ways you're never really, you're always going to be integrating experiences, no matter how long ago they happened.
Yeah, and even not psychedelic experiences, you're constantly integrating everything that's just happened before already.
That's a really good point, Hannah, because I'm not sure I always separate out a psychedelic experience from another experience that you may have had in your. Lots of experiences can feel very impactful, very significant for all sorts of different reasons, not just because you had a psychedelic drug.
Yeah, and you need to make sense of them just in the same way you need to make sense of a psychedelic experience, whether it's unusual, challenging, incredible, amazing. You still need to give it that time and that integration.
Well, that's why I was talking to earlier about psychotic experience. They're very unusual, and there's a lot of meaning and insight to come from those.
So I also know from working with you, Sara, through drug science, that you are very interested in the ethics associated with psychedelic therapy. And you've gone into detail a bit about how best to support participants. But I'm wondering how you also think about the informed consent process. So that's when you bring participants onto trials. How do you help them understand what people often call the ineffable, or the potential for challenging experiences, new world views? This is something that as a centre at Imperial we've been talking about a lot recently. So I would just love to hear your take on it.
Yeah, I mean, the ethics here are really, really important, and it can be quite challenging to explain to somebody who has no concept of how they might feel when they've taken a psychedelic drug, to be able to consent to something that they just can't foresee. And so we're left trying to explain to them how, emotions can feel quite intensified, how memories can feel, almost as though you're reliving stuff. Most people can get their head around that, but we also don't want to be so prescriptive in what we predict could happen that the person's almost led into, or their experience can be shaped by you being too suggesting of what might happen. So I like to spend a lot of time working with people in preparation, talking to them about what some of the issues at hand might be for them. So why are they wanting to have a psychedelic experience? What's the issue at hand that they are wanting to focus on? Why is that problematic for them? In what ways might it be challenging? So that they're clear about the intention that they're setting. And for someone who might say, what does she mean by that? It's, what do they want to get out of the psychedelic session? What is it that has been bothering them? And then to think about events or experiences in their life that might relate to that could possibly come up. And, just get the person to, again, think about that from different perspectives. If it were to feel as overwhelming or even more overwhelming, how would they feel about that? Is this something they would still want to do? If they felt that they weren't getting the support that they need, would they still consider what is it that they would need in order to be able to come into this experience? I think sometimes there's a danger that all of that could be rushed. And so I'm wanting to make sure that they've considered that from a range of different viewpoints so that they're sure that however intense that experience is, this is something that they would want to do and be willing to do.
And what about in a group situation? Group preparation, group retreat, say, and then group integration?
Again, even when there's group preparation, I always like to make space for somebody to come and ask questions on their own. They may not have felt able to actually ask what they needed to ask in that group situation. So I've nothing against doing this in group, formats, but I would be uncomfortable if that's the only opportunity the person had just to check things out with their therapist, even if it's 5-10 minutes for them on their own, just to make sure that they've been able to ask everything they need to ask.
And how would you design a group therapy approach? Would you still have it in the same foundations that we've spoken about already? Or how would you have to try and adapt that to a group setting?
Yeah, that would be, that can be really tough, and it depends on who you've got in your group. So having run groups, certainly on psychiatric inpatient units for years, I know that they can be really challenging, and I'm quite keen to, screen people coming into a group just so that we make sure we don't have people who are likely to experience things so intensely that they can't take into account the needs of the other participants as well. If you've got someone where that's likely, I wouldn't think that they're suitable for a group. So we're taking into account those considerations. But if we were going for a group, I'd probably design it where it'd be quite nice in preparation and in the group where people are also using questions to help people think about things from different perspectives. I've had a lot of people I've worked with say years later that they developed that questioning style for themselves. And that's really what I want. I don't just want them to get the benefit while they're with a therapist, but they learn to think about it from different ways, and they learn to be introspective and question themselves in an ongoing way beyond the therapy. Group settings are a great way where you can help people develop those skills.
Yes. I mean, I think even in friendships, you develop those skills. So actually, when you think about how that happens in a friendship setting or with other relationships, it makes sense that you could have that with a very well-held group setting. Yeah, I never thought of it like that, but that completely makes sense because it's something that's often spoken about in terms of how do we roll this out. And often the group model, as me and Joe often speak about, gets put out there as like one potential solution. But like with many things, of course, there's consideration and factors that you'd really have to think about. And in terms of rolling it out, the other big question is how will it be done in a way that people can access it? People who really need to access it can in an equitable way. And obviously you've worked within NHS settings. How would you see this integrating within the NHS?
I mean, there's slightly two separate questions there. I mean, how we integrate it into the NHS is one, but also that's dependent on the first question, which is, well, who would be able to do all of this work? And I suppose it depends on who we're working with as well. So anyone really, I think, has the potential to benefit from psychedelic-assisted therapy, because I see everything as being on a continuum, whereas quite often the people we work with on the NHS are people who've received a diagnosis, they meet specific criteria. But if we were less rigid in that way and looked at mental health as being on a continuum, we might be more open to saying, well, before somebody's reached the point where they end up meeting criteria for an actual diagnosis, had they been able to access help way before that, we could have prevented them getting to that point. I am a big fan of peer support. I'm a big fan of people who might not be qualified mental health professionals being able to do some brilliant work, supporting others to find new solutions to their problems. So I'd love things to develop in that way. And I think we have so much to learn as well from Indigenous populations who've been doing this kind of work for years and years and years, but wouldn't be regarded as mental health professionals. But what they've got is a brilliant approach to helping people do what I was saying earlier, focus on a problem, connect with emotions, be introspective, look at things and find new solutions They're great at doing that. I've spent years training people who are non-mental health professionals to be able to use questions in the way that I might do in therapy to help people find new solutions. We have all of that open to us. Okay, and I think if we're really going to scale this up, we may well need people to be doing that type of work. But then I can also see where you've got increasing vulnerability and people who might struggle to do that kind of work, where they may have issues that we would class as more diagnosable mental health issues, that they may need a bit more support. And so I suppose we might have people where they're at high risk, perhaps of harming themselves, or they are, at greater risk of having thoughts of, ending their lives or whatever. That's really challenging to work with. And we may need people who are more trained as mental health professionals to do that kind of work. So I see there's a lot of scope and a lot of range in terms of who we train and the type of work they do, where we could have a system where all of that is useful. But it needs to be carefully monitored, and we need to make sure we get people the right help from the right people. So I think if we are looking to scale this up, we may have on the NHS people with quite specific problems, but I would also like, connected to the NHS, people who aren't so well trained, who might be able to help people who are less at risk, for example. And we do that in a way where it's all controlled and
there's starting to be evidence for psychedelics successfully treating people with chronic pain. So kind of what are your thoughts about that? Is that a different approach, or is that a similar approach? Yeah.
Well, for me, from the way I work, it would be a very similar approach. But if you were to use a different therapeutic modality, a modality where they have, CBT for pain or CBT for anxiety and CBT for depression, you've got all these different conditions, for want of a better expression, that are applied to. They may have a different way of working depending on what the problem is. I personally think that a lot of the psychological processes involved in different problems overlap and are quite similar. So the way we can tackle those is not very different. And pain is one of those. I mean, pain clearly has, physiological components to it, but massive psychological components as well. And so if you're someone who's experiencing pain on a daily basis, you may well start to develop strategies to manage that which you think are helpful, but actually rabbit hole your attention into focusing only on your pain, which makes it worse. Having psychedelic therapy that develops your awareness through the therapy as well of what those strategies are and how they might actually be counterproductive, and then the space to think of, well, what new strategies might I develop, could be brilliant. For me personally, that process doesn't have to be very different compared to somebody who's come with depression or some other problem at hand. The processes maintaining it are often
So Sarah and Hannah, we have enormous potential here, it seems, as long as this is done right.
Very much so. And I think if we do it right and, we stop looking at problems as being, these diagnosable things with very different underlying pathologies, I think the scope is just broadened, and I think the potential is much greater.
It is a really exciting time.
It's a really exciting time. I'm so glad to be here at the moment, but it's also a bit of a sad time for me as well, because I see a lot of work kind of shutting down opportunities rather than opening them up. And sometimes that's about, people wanting to develop it's what I call the toothbrush phenomenon. Everybody wants their own toothbrush and nobody wants to share it. Whereas if, as professionals, we look and say, look, amongst all these different problems we're working with, there's a lot of similarity as well. So let's stop trying to look at the differences between them and focus more on the commonalities. Maybe we would achieve a lot more. And that's where I see the excitement. But I know there's a lot of people out there who might thoroughly disagree and want to keep everything separate.
I mean, I think you've explained kind of beautifully, what the similarities of actually the different approaches are and how they all kind of center on a few fundamental kind of concepts. I love your practice of questioning people, letting them do the searching. And I think that's...
Well, then they find their own answers as well. And that's what this is about. Psychedelic-assisted therapy, for me, was always about helping people find the answers for themselves and find their own solutions, rather than being told what to do or advised or told that the drug is going to be able to do it all for them. I think you're very lucky if that's the case. It really is about the work that you do for yourself alongside the drug. Yeah. And if you're coming at that from a context which is not safe, not supportive, and actually makes you feel quite fearful, you're not going to come out with the solutions that you get if you're in a very different, safe place.
Absolutely properly supported and held in a safe place. And it makes you think about medicine in general, doesn't it? That we become, as patients, we become helpless, and we're not kind of given the possibility. We forget, I think, the solution to our issues or our problems is actually within us.
Yeah, I mean, going back to the spinning plates analogy, you can imagine if somebody was saying, there's only a set way to spin those plates, and you've got to take this drug and it's going to help your arms do it in that way. Well, that might work for some people, but not everybody. And similarly, if you're trying to get somebody to learn how to spin those plates, but you've put them in such an unsafe environment and you're shouting at them, well, far from being able to look at the plates and find a way of, balancing them, they're going to be crashing them left, right and centre. So the context, I really can't overemphasise how important that is. It really needs to be a context that's right for that individual. And you're only going to find that out by asking them about it and helping them figure it out. Each person who comes to therapy really does have their unique set of needs. And as a therapist, we need to be able to meet those needs, to be able to help them do the work.
And to help the psychedelic do its work, I suppose.
Well, the psychedelic is what's going to help switch off all of that usual noise and all of the things that they're so convinced are the things that they need to be doing because they're helpful. But actually, in most cases, there's a lot that goes on that people do to cope, which is counterproductive. But you're going to get the volume turned right down on those when you take the drug, and that's the beauty of it, and also why actually having the therapy alongside is, I believe, equally important.
So you have the space to enable your own healing, I suppose. It gives you that, the therapy.
Yes, and healing, I suppose, to put into more concrete terms, is about developing awareness of the different things you want or need in your life, and being able to find a novel solution that's going to help you be able to do all of that at the same time, not just choose one over the other. So going back to that gambling example I gave earlier, you could say, well, I'll choose the functional being secure and stable and managing my finances. But actually, if you try and block out the bit that needed a bit of excitement, it needs to be, having a bit of fun, it's only going to bounce back later. You may sustain that for a short while, but you haven't come up with a solution that balances both. So I wouldn't be too optimistic about that being a long-term solution. But there are other ways of finding excitement and, having fun, and whilst also being able to be stable and secure. It might not involve that much gambling, but there will be another way of meeting those needs.
And helping people find what it is that's going to help them meet those needs, just in a different way.
Exactly.
Woo! Wow. We've run out of time, I'm afraid.
Goodness me, have we been talking for that long? Because I could have carried on.
Well, it's so interesting. It's absolutely illuminating.
Well, I've tried to explain it in ways that are maybe a bit more accessible with analogies rather than just, all of the scientific papers, which I hope.
It's really, it's really, really helped. Like, I think it's going to come across and people are going to be able to understand really what you're trying to get into the nitty gritty with psychedelic therapy, and also why the therapy is so important to help people in their healing process.
Yeah. And I love that, asking questions of people and enabling people to really, take control, I suppose, of their own destiny.
Yeah. And as we're asking those questions in the therapy, of course, there's a lot of attention to what's going on in the background of someone's mind. So, I'm asking, did a thought occur to you just then? Or what do you remember when you say that? And quite often that's where lots of the insights come from. So, it's not just about asking those questions, but really getting the person to search in their mind about what else is coming up for them. That takes quite a lot of practice to do that in a way that doesn't feel overly challenging or disruptive for the person.
Yeah. Fantastic. Sarah, I've absolutely loved this session. It's been fantastic. We've learned a great deal.
Yeah, fantastic. I'm going to be sharing it with all my colleagues to get them to listen as well, for sure.
Well, like I said, I really wanted to go for this feeling a bit more accessible. So I'm thinking, I haven't mentioned many papers.
No, that's not what people tune into the podcast for. There will be information in the show notes if people want to dive a bit deeper, but people really want, our listeners, and me included, really like a very good conversation about this with a lot of examples and analogies.
Good. And I always say to people when I'm working with them, it is going to involve a lot of questions and kind of soul searching in a way, and if they don't know the answer to my questions, that is a very positive thing, because it means we're thinking about this in a way that they haven't done before. Yeah. And of course, I think it's always Einstein, isn't it, who gets credited with that. You can't resolve a problem from the same perspective that you used to create that problem.
Yeah.
That's very much the case.
So thank you very much indeed, Sarah.
Thank you so much.
Thank you.